This is a picture of the two sets of longitudinal muscles down the back. And as I said, they're superficial, so they're just under the skin. This is longissimus, and to the side of it is iliocostalis. If you felt in your back, as you feel down the back, you'll feel absolutely in the center, you'll feel all these hard bumps, and these are bony spines called the dorsal spines. And then just to the side of that, there's a big lump of muscle on either side, and that is what's called the Erector Spinae. Erector Spinae are the group of muscles that keep you erect. So as they contract, they will make you arch your back. The most superficial part of the Erector Spinae is the longissimus, and it's made up of a whole series of vertical fibers which run down and finally join up into this area here, which I've talked of before, which is the aponeurosis, the very thick fibrous band that glues all this area together. The iliocostalis is further out, a good 2 to 3 inches out from the spine, beyond the mass that you feel as the erector spinae. These are also little vertical fibers, you can see them, and each fiber attaches to a rib and runs down, and in the end they all join together and they join into the aponeurosis as well, and a little bit into the iliac crest, which is where that name ilio here and costalis, which are the ribs. So it's the muscle that joins the ilium to the ribs. When this muscle contracts, it pulls you back, straight back. When this muscle contracts, it pulls you back and gives you a rotation. So it is a rotatory muscle of your spine. Both of these muscles are really vulnerable to injury, and they will cause the pain that everybody feels, not everybody, but almost everybody feels in their back, which may radiate up into your head, may into your neck, run down your spine, anywhere in this area, all the way down into your buttock. This is the pain that commonly occurs where people will go off and get manual treatment. And if all the person does is do a spinal manipulation, so you go, say, to a chiropractor and they will manipulate, you get that little click and you feel immediately better because you get a reflex reduction in spasm and pain. If the person only does that, then what tends to happen is it doesn't last. You need somebody to work on these muscle triggers on the side of the spine to get longer lasting relief. So what we look at now are the actual trigger points themselves and where they go. Trigger points can occur anywhere up and down this long band of muscle. If they occur up towards the top area, often the pain may occur locally, but the pain may actually refer up all the way into the base of the skull. If there are trigger points lower down in the thoracic area, again, the trigger points may be local here, which is the commonest place, but sometimes they refer through to the front, and you may feel it as chest pain. So that's worth remembering. If the trigger points occur lower down, and this is really common, which is the area where the ribs, which is the bottom of the thoracic spine, joins the lumbar spine. Now, this kind of area here, where there's a join between one structure which is inherently stable, and the rib cage creates stability in the chest wall, and the lumbar spine doesn't have that stability, so it's wobbly, where the join occurs, that's a very common place for trigger points to occur. When trigger points occur in that area, the pain may occur locally, but more commonly will radiate. So it may radiate out like this, and with the lower triggers, often it will radiate downwards and appear as a pain over the top of your buttock and in your lower back. This is a very, very common pain. I'm sure everybody can nod their heads to this pain. And if it occurs lower down In the lumbar spine, often the pain will refer lower, and so you may get pain here or even right down to your inferior gluteal fold, right down to the bottom of your buttock.